Hello everyone, today I am going to discuss about the anal triangle and ischiorectal fossa. So starting with the anal triangle is nothing but the posterior part of the perineum. So here in this image, here we can see the bony pelvis showing the outlet of pelvis. The pink one indicates the urogenital triangle and the green one indicates the uh, anal triangle. And here in living, this is the urogenital triangle and anal triangle. Anal triangle is common in both males and females, and it is bounded in front by an horizontal line joining anterior ends of ischial tuberosity. So these two triangles, they are separated by a horizontal line which joins the ischial tuberosities on each side, and the inferiorly on each side posterior inferiorly we have got the infrolaterally sacrotuberous ligaments, and posteriorly by the coccyx. So here it would be the sacrotuberous ligaments from the sacrum to the ischial tuberosity, sacrotuberous ligaments, and also the posteriorly by the sacrum. So these are the boundaries of anal triangle. It contains the anal canal in the midline. So in midline, the opening of the anal canal, and on each side of the anal canal, ischiorectal fossa, which is otherwise called as ischioanal fossa, are present. So these are the basic idea about the anal triangle. So the anal triangle has two components, the muscles and ischiorectal fossa. The muscle of the anal triangle is by the external anal sphincter. You can see the muscles by the external anal sphincter, and then it is and also laterally by a muscle called as obturator internus, and we can see the levator ani, which is obliquely present, levator ani converging towards the anal canal and towards the sacrum. Levator ani and coccyges are present, which forms the pelvic diaphragm. So these are the muscles. So the muscles of the anal triangle includes the external anal sphincter, obturator internus, levator ani, and coccygeus muscle. And coming to this ischiorectal fossa, so this deep gap what you are seeing on each side of the anal opening, pyramidal shaped gap, is the ischioanal fossa present on the either side of anorectal region, and it is separated from the pelvic cavity by levator ani muscle. So this is the levator ani which separates this gap from the pelvic cavity, and along with the levator ani there is a fascia also. And boundaries of the this anal triangle, anteriorly we have got the urogenital diaphragm. This is the urogenital diaphragm with the perineal membrane, which is separating the superficial and deep perineal pouches located in the urogenital diaphragm. And posteriorly it is limited by the gluteus maximus muscle. We can see the gluteus maximus muscle, and also posteriorly by sacrotuberous ligaments. This is the sacrotuberous ligaments present on the either side here, extending from the ischial tuberosity to the sacrum. So it is called sacrotuberous, ischial tuberosity. So sacrotuberous ligaments. So that is about the boundaries. Next, coming to the ischioanal fossa or ischiorectal fossa. Ischiorectal fossa, it is like a wedge-shaped gap between the anal canal, and it is filled with the fat mainly and loose areolar tissue situated on each side of the anal canal. So here is the anal canal, the gap. This is the ischiorectal fossa. This is the pelvic diaphragm formed by levator ani muscle, coccygeus and levator ani muscle. So ischiorectal fossa is a wedge-shaped, fat-filled space situated on each side of the anal canal below the pelvic diaphragm, and the two fossae, the right and left, ischioanal fossa, they communicate with each other behind the anal canal. So here is the anal canal. Posteriorly, this is the right ischiorectal fossa, this is the left. Both communicate with each other posterior to the anal canal. This space, they help mainly in the dilatation of rectum and the anal canal during defecation, that is during passage of flatus and feces. And the base of the fossa, it is lined by the skin. The base is lined by the skin, and apex is directed towards upwards and laterally here. This is the apex between the levator ani and the obturator internus, where we can see a fascia here. The fascia covering the obturator internus is the obturator fascia. Okay, and this is the apex. So the apex is directed upwards. So let's see the boundaries now. Laterally, it is the fascia covering the obturator internus, and along with the obturator internus muscle and ischial tuberosity. Still more laterally, we have got the ischial tuberosity. And medially, the fascia covering the levator ani. This is the levator ani. We can see the fascia covering the levator ani muscle and external sphincter, external anal sphincter. And posteriorly, sacrotuberous ligaments along with the gluteus maximus. Deep to it, the ligaments here would be the sacrotuberous ligaments, which are not shown in this image, extends from the sacrum to the ischial tuberosity, and on the posterior surface along with the gluteus maximus muscle, posterior surface of which is the gluteus maximus muscle. And anterior boundary, it is posterior border of the perineal membrane, and the floor of it is formed by the the floor perineal skin. You can see this is the floor, this is the roof. So the floor of it is formed by the perineal skin, and roof is formed by the meeting point of the fascia covering the obturator internus, and also the inferior fascia of pelvic diaphragm, that is levator ani. The fascia, inferior fascia covering the levator ani. This forms the roof. And we can see the pudendal canal, which is formed within the fascia of obturator internus. Pudendal canal is otherwise called as Alcock's canal, and through which internal pudendal vessels and pudendal nerve passes through the Alcock's canal or pudendal canal. So let's see some questions. So during incision and drainage of ischiorectal abscess, which nerves are injured? Superior rectal nerve, inferior rectal nerve, superior gluteal nerve, inferior gluteal nerve. So this I didn't explain before, so I will explain now. So the answer is the inferior gluteal nerve. And also one more nerve which is not mentioned in the options is the posterior labial nerve. So inferior rectal nerve, posterior labial nerve may be involved in injury to these nerves because, and also the vessels associated with it, because they are present in the ischiorectal fossa. And the perforating branches of S2, S3 and perineal branches of S4 nerves are also present in the ischiorectal fossa. So these are the list of the nerves which may get damaged or injured during incision through ischiorectal fossa. I'll repeat again: inferior rectal nerve, posterior labial nerves, and or posterior scrotal nerves in males, and posterior labial nerves in females, and also the perforating branches from S2, S3 and perineal branches of S4. Pudendal canal is a part of Colles fascia, Schrader fascia, Scarpa's fascia and none. I hope you all know the answer. Obturator fascia is the right answer. Pudendal canal is formed in the obturator fascia in the lateral wall of ischiorectal fossa or ischioanal fossa. So this completes the anatomy of anal triangle and ischioanal fossa or ischiorectal fossa. Thank you.